officials say the number of whooping cough cases is on the rise here in Texas. Compared to this time last year, we're seeing 3 times as many cases, reflecting a nationwide uptick. Reporter Daniel Peralt tells us what medical professionals are saying about the growth of cases.
Austin Public Health says they've seen 49 cases of whooping cough this year. Last year, there were 11. Why, for you guys, were those numbers so alarming?
We're particularly concerned about the very youngest children in our state.
Dr. Varun Shetty, the chief state epidemiologist, says anyone can get whooping cough, but infants are most vulnerable since their immune systems can't fight off the infection. About a third of infants who get it end up in the hospital.
They could develop things like pneumonia, in severe cases, even seizures, and very rarely even death.
It starts as a common cold but can linger and turn into vomiting and trouble breathing.
It could cause this really classic whooping sound when someone tries to breathe in while they're coughing.
Cases are rebounding after several years of unusually low levels that doctors attribute to COVID-19 precautions.
We're still less than what we were seeing before the pandemic, but we're headed in that direction.
Even though vaccinated people can still get whooping cough, Austin Public Health Medical Director Dr. Desmer Walk says it's the best protection, especially for young kids and pregnant women.
Getting those shots when they go for their preventative checkups and to go see their doctor is going to be important.
Early treatment with antibiotics can reduce the severity of the illness and limit its spread.
If you are worried that you have whooping cough or pertussis, stay away from others.
With cases surging as colder weather and the flu season start to blow in, Dr. Walk says now is the time to get vaccinated.
Having the shots that we need will help us have safe holiday seasons and allow us to protect ourselves and our community.
And that was Daniel Peralt reporting.